Welcome to Luca is a Billionaire, where the only thing I invest in is your answers.
You start by prioritizing safety. Check the medication label, expiry, and active ingredients to avoid harmful mixes. Once done, compare this to your current prescriptions and known allergies. This prevents accidental interactions. Make sure to note storage requirements and lot numbers in case of recalls. If you cannot confirm any of these details, stop and contact a pharmacist or clinician immediately, because guessing potency or purpose risks harm. This establishes a safe foundation before any next steps. You next assess whether self-treatment is appropriate by summarizing symptoms: onset, duration, severity, and triggers. Then, reach out to a pharmacist or clinician for professional triage. They can advise whether an over-the-counter option is acceptable or if urgent care is needed. Make sure to describe current medications and health conditions so they can evaluate interaction risks. Do not adjust doses or combine products on your own. Decisions about quantity and timing should come from a qualified. To complete the process, follow the healthcare professional's instructions exactly and keep a log of dose, time, and symptom changes so you can report outcomes. Once started, monitor closely for warning signs such as rash, breathing difficulty, severe dizziness, or any worsening of your condition, because early recognition matters. If you notice any adverse reaction, stop the product and call emergency services or poison control immediately. Remember, when in doubt, seek professional care rather than escalating self-treatment.
Thanks for watching and please subscribe. It's the best investment you'll ever make.